Welcome back to Daybreak, everyone. September is Prostate Cancer Awareness Month. Aside from skin cancer, the Centers for Disease Control says prostate cancer is the most common cancer in American men. Out of every 100 American men, about 13 will get prostate cancer during their lifetime, and about 2 to 3 will die from it. That's why it's important to know your risk factors and when it's time to get screened. Joining us now to talk about that is Dr. Kevin Brown, a urologist with St. Peter's Health. Thanks so much for being here this morning.
No problem. Happy to be here.
So tell us just a little bit about what groups are most susceptible to prostate cancer.
Yeah, so prostate cancer is commonly diagnosed in men over the age of 65, and as men get older, the risk increases. And so as the aging population increases, we see it more in men around the age of 60 to 65. We also see a higher rate of prostate cancer in men who are of African American descent.
And so what are some of the symptoms that you tell men to watch out for when they get to be around that age?
So prostate cancer, especially in its early stages, doesn't have a lot of symptoms, and so that's why screening becomes very important for individuals as they age. As men get older, they do have some urinary symptoms that can manifest, and so if you start to develop difficulty with urination or other signs regarding your urinary function, it's important to see your physician.
And how regularly should you be getting those screenings?
So currently the American Urologic Association recommends a yearly PSA starting at the age of 50 up to the age of 75.
And typically what does that screening look like if people haven't done it before?
Yeah, so prostate cancer screening is done through blood testing. We use a blood test called prostate specific antigen, or PSA, and that's a simple blood draw and then a physical exam by your physician.
Perfect. And how important is it to catch prostate cancer early? I know there are some types of cancers where you really want to find it fast. How is that similar with prostate cancer?
Yeah, prostate cancer is a very treatable cancer, particularly if it's caught early, where it's completely confined within the prostate. And when it's completely confined within the prostate, there are a lot of different treatment options, anything from medications to chemotherapy, surgery, radiation therapy. And the earlier it's caught, the more treatment options are available.
And I know St. Peter's Health has recently got a new tool to help with that, the Vinci robot. Tell us what that's about.
Yeah, so the robot that was recently brought into the community is a great way for us to offer a minimally invasive treatment for prostate cancer. Just like a surgeon would traditionally use a scalpel to perform a procedure, we can now do the same procedure with smaller, less invasive incisions and more precision using the robot.
And so what does that mean if you're a patient? Is it safer? Does it help with recovery times or things like that?
Yeah, all of the above. So the robot makes the surgery more precise and safer. It helps with recovery. People recover quicker. You spend less time in the hospital and kind of get back to your normal life much quicker.
And then real quick here, are there any lifestyle tips that you would recommend to people just to kind of reduce their risk maybe of prostate cancer?
Yeah, the best thing you can do to reduce the risk of prostate cancer is to have a heart-healthy diet, low in fat, high in fruits and vegetables, and do regular exercise.
Perfect. Thank you so much, Dr. Kevin Brown with St. Peter's Health. Good information. We appreciate you raising the awareness out there.
Absolutely. Thank you.
Thanks. And with